Here's a quick review on Mpox, simplified for your understanding. So on August 14, 2024, the World Health Organization declared Mpox a public health emergency of international concern. Basically, Mpox was considered a global healthcare threat, and all countries needed to take urgent and coordinated action to prevent the spread of the Mpox virus. A bit on the history on monkeypox. It was actually discovered in 1958 in Denmark in monkeys that were kept for research, and the first reported human case was in the DRC Congo in 1970. So these are the two primary strains of the virus. We have clade 1 and clade 2. In 2022, we had a global outbreak of the Mpox virus caused by the clade 2 type of the virus, and this is when most of us may have heard of monkeypox for the first time. In 2024, we had another outbreak, and this is what caused the World Health Organization to declare a public health emergency. Now, this is a quick overview from the World Health Organization's website. It's considered an infectious disease that can cause painful rash, enlarged lymph nodes, and a fever, which are the primary symptoms. It may also cause a headache, muscle ache, back pain, and low energy. It actually belongs to the Orthopox virus genus, which is a group of viruses that cause raised, bumpy rashes, similar to chickenpox, cowpox, and others. Initially, the virus could actually only be transmitted between animal to animal, but as we all know, has now been transmitted to human beings, similar to chickenpox and cowpox. Mpox can be spread through close contact, which includes any form of skin-to-skin contact, as well as respiratory particles. Here are the primary differences between the different variants of the virus, so clade 1 and clade 2. And clade 1, which had an outbreak in 2024 and prompted the World Health Organization to declare a public health emergency of the Mpox virus, is actually more dangerous. So it's easily transmissible, it causes more severe symptoms, and causes more deaths. So it has a mortality rate of approximately 10%. Mpox normally resolves on its own within 2 to 4 weeks, but in some reported cases have caused death and from these complications, which has affected young children and those who have a weak immune system. If you have Mpox, isolate yourself immediately because people are contagious from the onset of the first symptoms until the scabs from the rashes have fallen off, which is approximately within 4 weeks. It's also important to wash your hands frequently, drink lots of water, and consult your family doctor for treatment options. As always, follow for more simplified healthcare content.